Started. Good morning, good afternoon, everyone, depending where you're dialing in from. Welcome to our debut of HepTax Virtual Learning Collaborative and our kickoff call. This is an optional session. It's our NASTAD University for newer hepatitis staff. I see some folks trickling in, and I assume, again, just pending which clock you're looking at, others will join momentarily. So I just want to name that we have actually done this with a much smaller audience in the past. I think as folks join, we have tailored it to be more of an overview of NASTAD. We'll be sure to cover who we are, our hepatitis team, what our portfolio at NASTAD entails, and then also the official launch of our newer hepatitis staff toolkit, which I hope you can hear the excitement in my voice because it has been a long time coming. So with that, we're going to keep it pretty informal. I am going to start the hour with some introductions. So let's go to next slide. Okay, so for the folks that we have here, if you could introduce yourself. I know we aren't going to unmute, and take the usual time that we would in person, but here, if you can include your name, your title, your jurisdiction, and how new you are to your position. And I think when, we talk about new, it's subjective. You could have started yesterday or a year ago. It really is just, I think in the HEP space and the HEP world, you're always learning. So even with some of our survey results, you'll see that folks are new at 3+ years. So we will get into that as we go on. But I also want to introduce here, presenting with me, Heather Bush. She is at the Utah Department of Health and also an esteemed HepTac consultant. And she has been very involved with the newer hepatitis staff calls, disseminating survey results, developing the toolkit. And then I am tag teaming with her, Jasmine West, a manager on our hepatitis team. I'm in DC and I've been with NASTAD for about 2.5 years. And again, that's subjective. So if I talk to NASTAD staff who have been there for the 10 years they have, I'm still relatively new. So we'll just keep that in mind as we go throughout this presentation. But I did want to share that anytime Heather and I connect, we're always talking about our pups. So it's only fair that they make an appearance today. I want to introduce you, Heather's pups, Hazel and Bark, and then my pup, Moxie, and they are living their best lives right now as we work remotely, and they're just our tag team and coworkers. So if you want to share in the chat an introduction of yourself, looks like Seth is getting us started off here, but also if you have any fur balls at home, if you have any pets that you like to, are your constant coworkers these days, or if you don't have pets, you can still share a favorite animal or something rather. So we'll get started off with that. All right. I want to see if Boatma has joined. And
I'm here.
Boatma.
Hello.
Hello. I'm actually going to turn it over to Boatma, who's our director on the hepatitis team, just for a warm welcome.
Hey, everyone. I'll be very quick because I know Jasmine and Heather have a lot planned for you over the next less than an hour, and I get to talk to you again shortly after the meeting starts. So just wanted to say hello to everyone. Very excited that you're joining us, whether you are a coordinator on the prevention or surveillance side that's been around for a little bit and you wanted to get a refresher, or whether you are completely new to all things NASTAD and maybe even viral hepatitis. And if that is the case, you are in the right place. Don't ever hesitate to ask us what acronyms mean, what we're talking about when we're referencing certain partners or documents, all of those things. But to answer the questions that were shared, I'm Boatma Reed. I'm the director of hepatitis at NASTAD. I live in Maryland, originally from Michigan, go blue. And I had a parrot that I loved. I don't have any pets now, so I need to work on that. So I'll just live vicariously through all of you. But thank you both to Jasmine and Heather for the chance to say hi to everyone, and I'll see you later.
Excellent. Thanks, Boatma. We'll catch you in future sessions in the next hour. All right. Thanks for the intros. Keep it coming. Everyone has cats to dogs to, looks like we have a rabbit here. So Thank you for sharing. Let's transition to next slide. We'll just get started about NASTAD. So we are a national, oh my goodness, I thought I was on mute and I'm not, so I'm gonna keep going. We are a national nonprofit who works across the US and represents members who are working to advance HIV and hepatitis programming. NASTAD has 7 different programmatic teams. We have healthcare access, health systems integration, policy and legislative affairs, prevention, health equity, drug user health, and of course, our hepatitis team. And between our teams at NASTAD, we conduct trainings, we offer technical assistance. There's a lot more that goes into that, but specifically for health departments to improve health outcomes for people living with HIV and hepatitis. We are a forward-facing anti-racist organization that actively operates through a health equity lens, and that's infused into NASTAD's strategic plan, which is currently under development, and it will be shared out upon completion. Next slide, please. So here we do have our small but mighty team. We have here Jasmine and Terry Reed, who's our director, which she just gave a warm welcome and introduced herself. Let's see. I think I'm reading this out of order, but I'll go left to right. We have Alex Eanes, who's our associate on the HEP team, followed by Boatma, Isabel Lechuga, who's our senior manager, and then myself, a manager on the hepatitis team. We would be remiss not to name, although I do wish I had pictures of our newest additions. We have Juliana Esposito, Neha Dixit, and Nikki Nguyen, who have hit the ground running as our interns on the team. And as a team, we provide guidance to TA state and local health departments to develop, maintain, enhance comprehensive programs, and ultimately work towards hepatitis elimination. Let's see here. Next slide, please. Okay. So I think you can see here just a small, we got 3 pieces of the puzzle, but if you do take a step back, there's enough pie to go around for everyone, because within these 3 pieces, there are like 17 more pies. So lots of moving pieces, a lot of cross collaboration between teams. Hepatitis priorities include strengthening hepatitis infrastructure at the national, state, local, and territorial levels, including comprehensive prevention and surveillance capacity building through a health equity lens on the path to elimination. So if you take a look at these pieces, and we'll dive into the details of a few slides in. First, we have the Hepatitis Testing Partnership and Learning Collaborative. And under CDC Cooperative Agreement, NASTAD established a diverse national coalition of key stakeholders dedicated to improving viral hepatitis awareness, education, and training. And we convene through a listserv and quarterly webinars to share ideas, lessons learned, resources, and best practices. And this is the portfolio that I primarily oversee with the support of Neha and Nikki. So again, we'll go into some more details a few slides in, but this is also a really great opportunity for newer hepatitis staff to become part of this coalition, because there will be a sustained response even after the end of the cooperative agreement. Going into this next piece here, in 2019, NASTAD launched HepTAC, an online technical assistance and capacity building center for health department hepatitis programs. The primary goal of HepTAC is to build state and local technical expertise and enhance health department capacity to eliminate viral hepatitis. This is to note for, again, whether you're new or you're a seasoned hepatitis vet, we encourage everybody to familiarize themselves with this process. Direct TA is provided primarily through online platforms. So at NASTAD, we use GoToMeeting or our Zoom accounts, and we connect the requestees to our team. And it's normally a 72-hour response, which then we can connect to other programmatic teams, just depending on the TA request. Or we also have our HepTAC Advisory Committee, which is comprised of subject matter experts within health department prevention and surveillance programs. And Heather is one of those rock stars. So HepTAC is a project that's a joint effort between NASTAD and CSTILTS, which is within the Division of Viral Hepatitis. And we're about to finish up our 3rd year of this 5-year cooperative agreement. I still see some intros coming through. For those who are just joining, let's do our names, our jurisdictions, titles, and how long we've been at the health department. Earlier, Heather and I shared pictures of our pups, but it looks like Folks are also introducing their 2 kittens, or I saw somebody say 2 teen boys. I guess, that counts for a lot. So please make your introduction in the chat box. Our last piece of the pie here, we have our Hepatitis Appropriation Partnership. It's a national coalition that's based in DC and includes community-based organizations, public health and provider associations to increase federal funding for hepatitis. Because I think whether you're new or not, you already know hepatitis is underemphasized, underfunded, so we're always advocating for some more dollars behind it. This is led by our Policy and Legislative Affairs team, PLA, and is supported by the Hepatitis Team. We've had Hill visits, education of Hill staffers and others. There's coordination and hepatitis policy leaders across the country in collaboration with CDC. And quite honestly, my first year at NASTAD, it was my first Hill visit, and it was pretty rad to be on the Hill, talk with staffers, advocate for what you're passionate about. This last technical assistance meeting, we had some virtual Hill visits. So I think for everybody on this call, if you haven't joined, you'll probably have the opportunity to do so in the future, virtual or in person. Next slide, please. Okay, so we are going to just dive into a bit more detail here. You might see initially just a bunch of acronyms, which hello, public health, nothing new. We have acronyms galore, and then organizationally, we create our own acronyms. So HTPLC is the Hepatitis Testing Partnership and Learning Collaborative, and we are in the 5th and final year of this COAG, which is funded by DVH, Division of Viral Hepatitis. As previously mentioned, this is a broad coalition of stakeholders comprised of CBOs, clinicians, we have federal partners, we even have professors in academia, federally qualified health centers. Like, there are a lot of folks in this space who are passionate about hepatitis, want to share best practices, resources. So all these folks come together as part of this coalition. The partnership has representation from over 95% of the country, and both the partnership and learning collaborative participants have established numerous programs to advance hepatitis education, awareness, testing, and linkage to care, which was the primary focus of the COAG. This next bullet point here is NASTAD's collaboration with INSU, which is the International Network on Health and Hepatitis Substance Users. So last year, 2020, we received a Model of Care Award from INSU. And under this award, NASTAD and the New York City Health Department collaborated with the intention of expanding pathways to HCV testing and treatment, specifically for people who use drugs. So through the development of this was a comprehensive toolkit. We had 2 separate trainings, and NASTAD microsite that houses tools and templates. And again, I think this is a fantastic resource for newer hepatitis folks to familiarize themselves with. When you take a first look at it, it's like a 70+ page toolkit, but you can take a step back. One of my favorite functions is control find. You know what you're looking for. So you can find that within the toolkit, and you can take these tools. And again, they're customizable for your specific context. So I'm actually going to include that link in the chat box here so folks can take a look and have easy access to it. But all of these resources and everything we mentioned here today will be included in the recording and thereafter. I also want to give a shout out to Mira Johnson, Diana Diaz Munoz, and Marie Bresnahan from New York City, who definitely were key players in making the Model of Care INSU Award happen. All right, next slide. Okay. So as part of our hepatitis technical assistance cooperative agreement, we respond to TA requests from health departments via HepTAC, which was launched in August 2019. This graph here is as of last month, so July 2021, we received 71 TA requests from 34 jurisdictions, and the majority were focused on hepatitis C surveillance systems, strengthening and increasing access to treatment. And we actually had several requests specifically in terms of programs like 340B drug pricing. And because of that, I mean, NASTAD is here to help support the TA requests that come through. So it was high demand, like 340B drug pricing, and in regards to hepatitis, like how can we actually A, understand it, and B, increase access to services. So from those requests, it resulted in a 5-part 340B viral hepatitis webinar series. This is an excellent resource, I think, for all HEP staff to acquaint yourselves with. We have a subject matter expert who knows 340B in and out, and we defer to her when it comes to drug pricing questions like this. Next slide. One of our last initiatives that's led by Alex and Juliana are our elimination profiles in NASTAD. We are currently developing viral hepatitis elimination profiles for all member jurisdictions because as it stands, there's no central website that houses comprehensive elimination related progress across jurisdictions. So you can't click, this one spot and say, all right, Heather, what's Utah doing? And you're like, well, actually, let me tell you. So NASTAD right now is underway, making sure that we collect this information. The profiles will provide that comprehensive overview of elimination progress. And they include information like epidemiology, surveillance reports, coalition activities, healthcare policy, you name it, it's pretty comprehensive. We have done a test pilot with 11 jurisdictions. We've received their feedback and also feedback from our HepTech consultants. So we do have a newer version of the template. It's a little fuzzy here, but I think some folks on this call might actually be requested to fill this out in the coming months because we anticipate the final product being published on NASTAD's microsite in fall 2021. So now let's jump into some of the good stuff here. Next slide. All right. So not to say that everything I just talked about wasn't some of the good stuff, but this is where it gets exciting because I do think a lot of this stuff has been underway for a while. So the newer hepatitis staff toolkit, say what? Thank you, Heather. I actually realized I just said that out of habit because when I say that to my kids, they always respond, what? So I'm just going to pretend that that's what happened just now. So for the newer hepatitis staff toolkit, we are going to go through some survey results. Heather is going to jump in, provide a high-level overview of the toolkit. We'll discuss a brief how-to with HepTech and then also next steps moving forward. So Heather, I am going to next slide and turn it over to you.
Thanks, Jasmine. And I'm loving reading everyone's comments in the chat and seeing the wide variety of people that are here and the wide variety of pets that we have. I think many of us got COVID puppies or COVID bunnies or things like that. And like Jasmine said, it's nice to be home and be with them most of the time. And hopefully mine will not interrupt as I'm speaking. But our first task really in trying to understand what were some of the needs of our newer hepatitis staff was we put out a survey and we got 24 responses from 19 different states. We asked all sorts of questions about what types of, what their roles were, how long they've been in their job, but then what are some of the things that they needed. And these were some of the people who responded. Many people were full-time hepatitis prevention coordinators, but many other people were full-time with multiple roles. So they might be doing hepatitis prevention and epidemiology. They might also be doing other programs, working with SSPs or HIV or STIs. So many people had cross-cutting roles. Also, you can see in the official job title that people indicated some different types of roles that they had. And so we recognized that most newer hepatitis staff is not full-time dedicated to their role, and so they may have a bunch of different things, but we wanted to figure out what we could do to help people. And as Jasmine also mentioned, that many people still consider themselves newer at 3+ years, which I think is great because it can take a long time to really, especially if you're split in many directions, it can take a long time to really feel like you've got your feet underneath you. So never feel like, oh, well, I've aged out. The newer hepatitis staff resources and phone calls and all of those are available to everyone, because you may change roles within hepatitis. You may be like my colleague Amelia, who left hepatitis for a little while and now is coming back. There's a lot of different things that that may happen. So, but you can see here that many people, you know, about a fifth of people were 0 to 6 months. A couple of people said that it was their first day on the job, things like that. And we did do this survey back in 2019, which we all know that 2020 didn't actually happen. So this really was only a year ago. But we took that, and if you want to go to the next slide. And some of the other information that we asked was what was the most helpful information they received when they first started in their hepatitis role. We wanted to understand what types of things information that they got that was helpful, so that we could try to integrate that into the toolkit as well. And some of them were really the expertise and knowledge of coworkers, which is awesome. But we also recognize that many times people may be walking in blind. Either their position is new, or the person who was in their position before has since left, so they didn't have the advantage of kind of being passed down or having a mentor. So it's one of the great things about NASTAD HepTech is that there is that connection and the opportunity to consult with other people. And they really did enjoy the NASTAD monthly calls and the TA meeting. Other types of meet and greets, reading the different plans, understanding some of the different things that are going on throughout the country, attending different trainings, and then of course some of that peer-to-peer learning. Go ahead to the next slide. And this next slide highlights some of the things which were some of my favorite pieces, were when people put in comments about what advice would they give, what did they want to share, and these are all excellent pieces of advice. There we go. One said, the best thing I did for myself was to ask questions. It didn't matter how silly or straightforward they seemed. If I didn't understand, I asked. And Jasmine mentioned that that even throughout today, please ask questions. That's what NASTAD and HepTech are here for, is to help you with anything. And we can direct you to maybe a different person or a resource or anything else. So please never hesitate to ask questions. And along with that, someone else said, talk to as many people as you can. Make those contacts and connections. You can't go wrong having a wealth of community resources. I worked in HIV for a very long time before I started working in hepatitis. And nothing against HIV people, because I'm still an HIV person, but I have found that viral hepatitis people are such a great community, and they will help each other out left and right. And so you're never going to be alone. So even if you maybe feel alone at your health department or someplace like that, you're never going to feel alone with all your colleagues throughout the nation. Free trainings and webinars was a great way to build knowledge, answer questions, and meet people. I agree with that. Take every webinar, attend every webinar, every training that you possibly can, that your schedule will allow. Even if a lot of it doesn't make sense at first, it will start to absorb. So that was some great advice. And then my role was brand new for the state hepatitis C program, so it took me a full year to figure out how I fit into the HIV, STD, HCV program, and how much surveillance plus outreach I needed to spend time on. I think that's a very common sentiment. And again, like I said, just because you've been there for a long period of time doesn't mean, you know, chronological time that you feel prepared. So there's always things to learn. There's always things. I stayed on the new hepatitis calls. I started in 2011, and I think I stayed on them till maybe 14 or 15, like for 3 or 4 years. It was still such a great way and to meet with people, and which is why I was really excited as a HepTAC consultant to be able to put together the toolkit. Go ahead and move on to the next slide. So here's our toolkit that Jasmine was announcing, and you guys may not find it super exciting, but this toolkit, it obviously doesn't cover everything, but it's a starting place. So we took those survey results, also many of our experiences and things that we had wanted to know or needed to know, and put them together into a really basic toolkit. You can see some of the different elements here. It's not super long, but it has tons of links and resources so you can continue and kind of, it's a starting place to know where to go. Go ahead and go to the next slide. So looking at this high level overview, there's viral hepatitis general resources. So some good information on just getting your feet under you and really understanding about viral hepatitis, understanding some statistics and surveillance. But we can't forget our friends hepatitis A and B. So much time we spend on hepatitis C, but even if your jurisdiction isn't doing much with hepatitis A and B, it's really good to have that understanding under your belt. So we have some information there. With hepatitis C, we break it into general information about testing and treatment. And then we discuss some of our priority populations, especially people who are in corrections and people who use drugs, because those are two huge areas of people that you may be working with or are definitely affected by viral hepatitis, especially C and often B. And then we talk about co-infection with specifically HIV and STIs. So there's lots of resources there, and you can see by looking at these samples here, it's basically a brief, you know, here are some resources, here's where to find out more. And we recognize also that we could have put tons more, but many of these will be a good starting point for that rabbit hole that you may go down. So for example, you go to the CDC website, Division of Viral Hepatitis, and then it will lead you to, here are other, you know, here's some other good resources, and you can go along that. But here are some good ones to start out with, to bookmark as you're getting started. And even if you do have some good background, I still recommend that these are great places to start and to have just in your toolkit. That's why I love the term toolkit, because I really feel like we're providing you with all these tools. Some of them you may use often, some of them you may not use very often, or you forget about in the bottom of your toolbox, but you can dig around and say, ah, that's right, this is here. Also, an important thing to remember with this toolkit is that it's a living document. So we finally got it kind of finalized, updated, made to look all pretty, put into a PDF that we're going to be sharing with you all. But that does not stop there. We're going to be reviewing it at least quarterly, and are also always looking for suggestions. Do we have a slide on that? I can't remember, Jasmine. So just to email, is it hepatitis@nastad.org? Is that the general email? Yeah, so if you're looking at this, or you're coming across something, or you as a new person can say, oh gosh, you know, this resource was really helpful, or have you guys considered this? Or if there's something, God forbid, like a link that doesn't work, or maybe, and I found as I was going through and reviewing this, that some of them, the links have moved, things like that, or there's a more updated resource now. So please feel free to help us with that, because this is a document that's for you and by you. So we want it to really be that integrated information. And then we'll be continuing and expanding into some other areas. Go ahead to the next slide. Some additional resources that are here in the toolkit are an overview of some of the top national viral hepatitis plans and recommendations. I know that when I started, this was a really good place to go, and did a lot of copying and pasting of these as I was putting together some different information, and that's what they're there for. They're really here as guides to help you get going and developing your own plans or updating your plans within your jurisdiction. Many of them have been updated in the last year or two, which is exciting. And some of them are still in progress, but it's a great resource. And then an overview of some of our national partners. We have a few of them now. We'll be adding more as we go along. And then, like we said, we're going to add on another section that'll go into some more detail, but this is a good starting point. Is there anything about the kit that I missed, Jasmine?
I don't think so for now. I just would like to reiterate, it's this living document. Just naturally, links and stuff are moved, updates come out. So this will be updated on a quarterly basis. But again, I am 2.5 years new to NASTAD, but I'm always, looking for the new perspective where it is like, oh, well, this would be really useful, something that maybe I haven't considered or that we can include. So please, please, please.
So Joyce has asked if we can share the link to the toolkit. What is the plan for disseminating it, Jasmine?
Yeah, so for dissemination, it's in PDF form. It will be circulated with all of the materials post the VLC session tomorrow. It will also be uploaded to the VLC microsite that NASTAD has. So this will all be shared after the kickoff.
Yes, and like we said, we are completely open to any type of feedback and, ideas, suggestions. This is a living document and it's a communal document as well. So if it's not useful for you, then it serves no purpose. So we definitely love to continue to hear. And we may also be sending out another survey in a little bit to say, have you used it? What was helpful? Those types of things as we continue to move forward. So we always appreciate your input.
Very much so. Thanks for that, Heather. So I think, we will allow time for some question answer at the end before we wrap up, but HepTach, again, is our Hepatitis Technical Assistance Center. I do just want to name that there's a how-to guide that's included in the toolkit. You will receive a login as a health department staff. You're able to request TA. We allow a 72-hour time frame to respond to requests, and it's normally sooner than that. You can indicate if this is time sensitive, if it's not. We are going to reach out. We'll be in touch thereafter just to get a better idea of what you're looking for, what the TA request entails, and then how NASTAD can connect you to the resources and experience that you need. So if that is a one-on-one with a HepTach consultant, if that's, oh, hey, yes, we have that resource, here's where to find it. It really just varies across the board. So I venture to say you can't request something that's wrong. Like, I think a lot of times, we're our own worst enemies, where we're like, ooh, I'm new, I should know that. Or I'm not so sure that's an appropriate TA request. Like, ask for it and we'll navigate you, point you to in the right direction at least. So I also know we're all here for the virtual learning collaborative sessions. We're in a position, we're going to soak it all up today and then actually put it in action in the, I was about to say days, but months, years moving forward, as we work towards hepatitis elimination. So we will have standing monthly work group calls as NASTAD. We have heard from folks that they're beneficial to hop on, hear about NASTAD updates, jurisdictional updates. Is also a 1-hour space where people can say, hey, here's what's actually happening. And other jurisdictions can be like, oh my gosh, I'm not the only one. So it's a really great space to share what's going on, and then also how NASTAD can support thereafter. We have a bi-monthly newsletter that goes out to our NASTAD Health Department staff, and we have updates, publications, federal partner information. Even if you just quickly peruse the titles of it, you might find something that's relevant to the HEP materials that you've been looking for. But you can also always reach out to hepatitis@nastad.org, and we will respond because we're here to support y'all. Heather did mention our newer hepatitis staff calls. 2020, reflecting back, I think that a lot of folks were detailed to COVID. Calls just weren't highly attended because everybody just had different priorities, and it was a whirlwind of a year for us all. So we are reinstating our newer HEP staff calls on a quarterly basis. The calendar invites will be forwarded. They are already on the calendar through 2022. So post this call, I'll make sure that all of the attendees here have those on the calendar. And I think just to reiterate, this is a living document. Additional components will be added, especially to the point about our local partners. One piece of feedback that was on repeat was, reach out. Like your connections are the answers. So we will update that section with our local partners, which is being prioritized. So I think with that, let's see, we have about 12 minutes. We will wrap up at 12:50 Eastern time, and the session will start promptly at 1. But do people have questions? I mean, that was a loaded NASTAD overview in a nutshell. This is the toolkit in a nutshell, but whether you're 1 month or 3 years, does anybody have like an urgent or I've been waiting to ask question? And I think while you're ruminating or, typing it in the chat box, let me actually reach out to, or let me ask Heather. So to date, you've been in this space. I think you mentioned, you started kind of without the institutional knowledge of a hepatitis position. So I think a lot of times people are finding the best approach to asking those questions. So yes, you can ask NASTAD, but if you have, a health department staff member down the hall, or you you should be in touch with somebody, like what's the best approach to reaching out to them? Is that like a phone call, an email? How do you connect to make that personable, like rapport building?
Yeah, I think that's a great question. And I think some of us are maybe shy around the phone. Some of us may feel a little funny about that. And one of the things that we hope with some of these calls and these meetings that you'll also get to meet some of your colleagues in the different places and put a face to it. It's one of the great things about the in-person TA meeting is that you literally get to meet people and maybe go to dinner with them or stand in the hallway and chat with them. But since we don't have that advantage, at least for the next little bit, don't hesitate. Like I said, people are so kind and helpful that I've found, and I've had people reach out to me that they will, just send a question in the chat during a meeting and say, hey, Heather, can you send me your email? I'd love to talk to you. Or they'll send me a, follow-up email afterwards, or people will give me a call. And I do know that, like I said, that sometimes phone calls can be challenging for people. I often forget to even check my voicemail, which is a bad habit of mine. So I'd say also don't be offended if you reach out to somebody and you don't hear back from them right away. We all going to be buried in our emails a little bit, but also don't hesitate to, if you reach out to somebody, you don't hear back from them, reach back out to Jasmine or anyone on the NASTAD staff, and they can maybe reconnect you or make an introduction, which sometimes can be helpful. I've really enjoyed that as well. And I agree with Jasmine also that it never hurts to submit a TA request. And even if it's something really silly, even if it's not silly, but it may seem silly to you, even if it's, hey, can you give me so-and-so's email address? Or I really want to talk to somebody who's blah, blah, blah. Also, don't feel embarrassed to answer any of those calls that may come out. Sometimes NASTAD staff will send out an email saying, hey, does anybody know anything about this? And don't feel like, well, I'm new, I don't know anything, I'm not an expert. Answer those calls as well, because it's amazing how much help. I mean, I'm still in direct contact with many of the people who were kind of in my cohort of newer staff that first year or two. And we still help each other out on so many different things, even though some of us have moved on or, you know, had different roles within the health department. We've been able to continue to help each other. So I think the ultimate tip is don't hesitate to ask. Don't hesitate to reach out. And like I said, most hepatitis people are just awesome and super helpful.
Thanks for that, Heather. All right, I was hoping for some questions in the chat, but I do believe that folks can unmute themselves if they have it, or if they're able to. If not, I am going to include, this is an evaluation link for this session specifically. So we still have 7 minutes. We'll keep the line open if you do have questions. But in the meantime, please feel free to fill out that evaluation link. Let us know what's helpful, you know, what's not. We're always taking the feedback so we can really just tailor tools, presentations, everything to the needs of the jurisdictions and health departments that we're working with.
And while people are doing that, if you guys are hanging around, does anybody want to share what some of their experience has been coming on as a newer staff? How are you feeling overwhelmed? Are you feeling pulled in a million directions? Do you feel like this is what you were meant to do? Anyone, just even if you just want to pop a sentence in the chat, or if you want to take yourself off mute, just to briefly share some of your feelings or experiences. I know some people, this may be your first day of work.
I'm hoping for the latter, where they're like, yeah, I was made for this.
Yeah. I remember when I started in hepatitis, like I said, I'd been in HIV for many years, and the position opened up, and my boss basically said, do you want to do hepatitis? And I was like, sure. And I remember for the first 6 months or so, I was very lost and very sad in a lot of ways. I was like, I knew HIV and I felt I was the only person in the health department that really did anything with hepatitis at the time. So I felt very lost. And NASTAD literally was the thing that saved me. And working with the TA center and feeling connected to other people, but it took me a while. It took me a good probably 6 months until I started to feel like, oh, okay. And then I started to feel like, oh, I was born for this, you know. And hepatitis very quickly became my second love. I thought I was an HIV girl through and through, and then I came on. And someone just put about that they're excited to get started, but COVID is straining our resources. And that's such a challenge that people have had over the last year and a half, coming up on 2 years, is that they have had to put aside their hepatitis duties to focus on COVID. And that's so challenging. was at a meeting where one of our hepatitis docs talked about how it feels like so much of the progress that we've made in the last couple of years just slipped away with COVID, that we've lost a lot of momentum. So I'm glad that you all are here and are excited to move forward, and don't give up hope. Hepatitis, unfortunately, isn't going anywhere, and hopefully COVID will. But we do definitely recognize that and appreciate the time that you're dedicating to hepatitis, whatever time you can.
Absolutely. I think too, in the past year, we have had some TA requests that are specific to COVID and leveraging the syndemic. There have been a handful of webinars too that are talking about hepatitis has kind of fallen off the radar. So how do we put it back on? But with funding that is going towards COVID testing, et cetera. So I don't think there's a streamlined answer to what that looks like, especially moving forward, especially with new variants coming out. But I do think it's something that we have on our radar, especially when it comes to our Hill visits and advocacy with our policy and legislative affairs team. So, I mean, we keep doing what we can, but yes, we hear you when you say it's straining resources, and yeah.
Exactly.
Well, thanks to Terry. She did just post the link for the next session. We will end here in a couple of minutes and then close the session to join the next one at 1 o'clock Eastern. Then it looks like Terry here. Oh, excuse me, Tara.
Yeah, there's a couple of comments.
Tara's so passionate about hepatitis, but didn't know it at the time. See, that's what we like to hear.
Mm-hmm. And it is so exciting to be a part of a disease that can be eliminated, and to be there in this time. When I started in hepatitis, when they were just starting to come out with some of the new medications. And so it was just opening this up, and it's just such an exciting time now. So we'd love to have that enthusiasm. And Sandra is a new VPD nurse in Mobile County, Alabama. Exciting. And I've only been doing this for 2 months. Yes, welcome. I hope that at the end of today, you're going to feel a lot more comfortable. And then, of course, when you get the toolkit and start perusing some of the HepTech resources, that you'll feel at least like you've got a lifeline.
Yeah. I like that. I do think, putting myself in the shoes of going through all the sessions today, you might be in a space where you're going to nerd out and soak it all up. You might be in a space where you're like, okay, I have so much to learn and it's over my head right now. But this is, we're all on different pages, but we're reading the same book. So whether you're just in the table of contents or you're actually just finishing up that last chapter, like, we are still all in it together. So again, I want to reiterate, NASTAD is here to support. We have awesome HepTech consultants like Heather who are working alongside of us, supporting health department staff and really working towards telling our grandchildren that we used to have hepatitis C, because hepatitis elimination, is on the global radar, is happening currently with this grant that we're going into. So I would like to thank everybody for joining.
And it really does take all of us, it does take all of us working together and helping each other, because there's no need to reinvent the wheel. There's so much knowledge and ideas and everything out there. And so it's a great family to be a part of.
Yes, yes. Thank you, Heather. Thank you, everybody, for joining. We will close out of this session and join the next session at 1 o'clock Eastern time on the hour for opening and welcome remarks from NASTAD's Executive Director, Dr. Lee, and then Division of Viral Hepatitis Director, Dr. Carolyn Wester. So I'm going to include that link there again. If everybody could navigate there in the next 10 minutes, then we'll see you then and throughout the day.